Hello, I'm Dr. William Moyle, and I'm a practicing sports physician for the last almost 30 years now. And I practice in Miami Beach, Florida, and I have the opportunity and the privilege of being able to work with professional athletes, Olympic athletes, world-class athletes, as well as patients from 84 countries over the last 30 years that fly into our center. With back pain, most patients that suffer from it are looking for alternatives to surgery because they know that even though surgery may be indicated, it's not always offering the best results. Now, over the last 30 years, we've seen an increase in back pain and disc problems, even with younger populations. So the different types of back problems that we see in the office are typical. Sometimes it can be a facet syndrome, sometimes it can be a disc problems, other times it can just be a simple biomechanical problem or muscle problem causing the back pain. IDD Therapy helps restore mobility and dysfunction by creating an environment within the spine that triggers the body's natural ability to heal. As pressure within the disc reduces, nutrient-rich fluids begin to flow into the disc and blood flow increases to the area, flushing essential oxygen to the surrounding tissues. And because the treatment is dynamic, the patient is gradually and gently mobilizing the spine, which also helps increase range of motion. So this therapy is beneficial for disc herniations, degenerative disc sufferers, even some spondylolisthesis patients see great improvements. What I'm talking about as far as a disc, normally, let's pretend this is a disc. By the age of 35, we know that the imbibition process starts to disappear. And as a result, the disc have less and less hydration taking place, which creates desiccation or dehydration of the disc. And with the compressive forces of the spine and the body weight, you start to have this compression taking place. Now, what I'd like to tell all the physicians out there and all the patients out there that are suffering with disc problems, and the physicians that are looking for an alternative to surgery and helping their patients with disc problems, is to really do your research. I've been involved in this for the last 7, 8, actually 9 years now, and I can tell you that it's made a tremendous difference, not only in my practice, in my ability to obviously generate more income, but really what's more important to me was to be able to help more patients, especially the high-level athletes that we take care of, because their alternatives was instantly and automatically to be sent for surgery. And I can tell you about one athlete who's a super high achiever hockey player that was told by 3 different physicians, the team doctor and then 2 others outside, that he had to have surgery. He refused it, didn't want it. He was referred into the office, and within a 7-week period, he was back on the ice at 100% with no limitation, without surgery, without drugs, without shots, epidurals, or anything like that. So if you're looking for an alternative, I invite you to contact North American to find out more about IDD Therapy, or even call my office and I'll be more than happy to talk to you about it.
If you feel pain in your back or in your body, you need to come to this clinic and try to do something to help to yourself. It's like just to try it.
If you've been suffering from disc problems that just doesn't seem to get resolved and do not want to have surgery and are looking for an alternative, then I want to invite you to check out our office and to come in and speak with me directly to see if you could be a candidate for this amazing new protocol using IDD therapy that does not, again, involve surgery or drugs, but can get you back to function, to get your life back, be able to get back to work, and be able to play sports again.